Physical therapy, braces, and other assisted devices are all treatment options for someone with cerebral palsy. Our next insider explains the benefits.
Rehab is very indicated for patients with cerebral palsy. Just remember that rehabilitation is a medical specialty dedicated not only to treat, but also to prevent further complications from specific disabilities, and mainly to help patients to maximize their potentials, to be able to achieve certain skills that are going to be giving them the independence to perform their activities of daily living. So that's why it's so important, especially in this group of patients.
And Dr. Arenas, as a rehabilitation physician, you firsthand see how it works. So how often are you seeing patients that maybe come in with difficulty, but through rehab are improving?
So cerebral palsy is a condition that is very frequent. We as physiatrists or rehabilitation physicians, we see very often. And of course, apart from the evaluation that we do in these patients to be able to determine the specific disabilities and put a plan for priorities, rehabilitation process is a main thing that we can provide to this patient, because they're going to have a lot of rehab needs, not only as in their childhood, but also when they become adults and throughout the rest of their lives.
I want to remind our viewers that you can call in and ask the doctor a question or share how maybe rehab has helped you by dialing 855-796-4475. We'd love to hear from you. Now, doctor, let's start with the basics. What is cerebral palsy?
So cerebral palsy is a non-progressive medical condition that affects parts of the brain. And it's going to manifest as an abnormality of movement control and also posture. It usually happens in pregnancy or in utero, and it's gonna put the patient with a lot of deficits, especially motor deficits, sometimes speech deficits and cognitive as well.
Is it considered a disease though?
It's probably more like a neurological condition that has a constellation of symptoms and signs, the clinical signs that are gonna manifest in patients in different ways, really.
Is it something that you commonly see, or?
We see very commonly, actually, cerebral palsy is the #1 cause of childhood disability. So it's a very common condition that we see.
Now, the Centers for Disease Control and Prevention says CP is more common in boys. So is that something you see in your practice as well?
We do see more boys and girls, yeah.
Okay.
So this is, remember, this is mainly a childhood disability. So we see cerebral palsy mainly when we approach the children population, and it's more often in boys and girls.
I want to talk about some of these causes that we see up there. You mentioned briefly the gene mutation as well. Can we go over these, Dr. Arenas?
Yes, of all the lists that we have here, I want to probably mention that the main, and is more than cause, is a risk factor that we see during pregnancy, at the moment of delivery, or even a few years after delivery. So maternal infections are very important as a risk factors for patients to develop cerebral palsy.
What kind of infections are we talking about?
Well, we're talking about a constellation of infections that imply herpes, syphilis, toxoplasmosis, and cytomegalovirus infections. Those are the main infections in the mother that can present as a risk factor for the baby to develop cerebral palsy.
Now, a mother's health then, based on these, is of crucial importance during pregnancy, even more so because it can be a factor. Exactly,
it could be a factor, and all those infections can pass to the fetus, of course, in utero, and affect the immature brain, especially in the first 3 months of pregnancy.
Now, enduring the last few weeks of pregnancy can be physically and emotionally challenging for some women. It may seem easier to relieve symptoms associated with late pregnancy by electing to deliver early. But researchers caution that there can be an increased risk of complications to the newborn. So let's find out more from the Mayo Clinic.
There are complications for both the newborn as well as for mom. So some of the complications that we see are both an increase in morbidity, so problems like respiratory difficulties, feeding difficulties, an increased risk of having problems potentially like cerebral palsy. Even though the overall risks are very low, they're higher compared to babies that are born at 39 weeks or later.
So can a mother's not being able to up to date their vaccines cause as well a risk for cerebral palsy?
Yes, absolutely, because they can develop potential infections that are going to affect the brain of the baby in utero and can predispose to develop the condition.
So if a baby has an illness, let's say, it increases that risk of CP already?
It depends. So yes, it depends again on the type of the disease that they have, because some diseases are going to predispose more the baby to develop the cerebral palsy if they are going to go directly to the immature brain and disrupt all the development.
But it doesn't have to happen just at birth.
No, as a matter of fact, cerebral palsy is a condition that happens during the pregnancy, so in utero, around the time of birth, of delivery, and even 3 years after delivery. So that's the timing that it gets. Depends on the factors.
And the lack of oxygen. This is also a big risk factor, correct?
So lack of oxygen or anoxia is mainly present in those near drowning episodes that we have so frequently, unfortunately, here in Florida.
Oh, yes.
And the first 3 years of life, if they go into the pool, they present like a near drowning episode, that lack of oxygen is going to be an insult, a non-traumatic insult really to the brain that is very immature still, and then this patient is going to develop a cerebral palsy.
If you want to find out more on rehab options for someone with cerebral palsy, including the benefits of horseback riding, just download the Health Channel app. That does it for us today, folks, along with checking out our website. Be sure to follow us on social media. We're on Facebook, Instagram, and Twitter at AllHealthTV, #AllHealthTV. And thanks for watching the Health Insiders on the Health Channel. I'm Kathy Buccio. See you next time.